Hello, my name is Alejandro Clavier. I'm a pediatrician at Vida Pediatrics and a member of the executive committee of ICAP. And we're going to talk about immunizations in the Latino community. So, Latinos, Hispanics, what words should we use? So, the census uses the term Hispanic and Latino interchangeably. So, OMB defines Hispanic or Latino as a person of Cuban, Mexican, Puerto Rican, South or Central American, or other Spanish culture or origin, regardless of race. So it's important to know that Latinos or Hispanics can be of any race. If you want to make a little differentiation, Latino is any person of Latin American descent residing in the United States, and Hispanics are people who share the common language of Spanish, but the terms are going to be used interchangeably always. So Latino by the numbers. So currently, there's about 59 million Latinos in the U.S. It's the largest ethnic minority, about 18% of the nation's total population, and the median age is 29 years, so about 8 years younger than the general population in the U.S. In 2016, the projected population of Latinos is going to be about 119 million, which is going to be about 28.6% of the nation's population by 2060. In Illinois, there's about 2.2 million Latinos, about 17% of the total population, and in Cook County, 1.3 million, so about 25% of Cook County's population. About 2/3 are of Mexican origin, and about 40 million U.S. residents age 5 and older speak Spanish at home in 2015. So more than half, about 60% of all Spanish speakers speak English very well, meaning that 41% speak English either well, not well, or not at all. And 34.4% are foreign born, and that's down from about 40% in the early 2000s. Poverty rate for Latinos is about 21.4%, so higher than the US rate of 13.5%. And about 18% of Latinos had no health insurance in 2016. That's about double of the US rate. And in Illinois, there was a significant decrease in the uninsured rate because of the ACA from 2009 of 13.8% to 6.5% in 2016. So I know I'm preaching to the choir here, but so we know that the wonders of vaccines, okay, along with tobacco control, cancer prevention, seat belts, reduction in vaccine preventable diseases is one of the 10 greatest public health achievements in the first decade of the 21st century. And just to give two examples, the pneumococcal vaccines had saved about 13,000 lives. So 30,000 deaths have been prevented during 2008 because of the pneumococcal vaccine. And the rotavirus vaccine has prevented about 50,000 hospitalizations each year. But we also have to know there's about 20 million cases of measles worldwide and other vaccine preventable diseases. So importation of these diseases from other countries remain a risk for unvaccinated US children. So we need to keep a high vaccination coverage. Vaccine coverage for Latinos. It's important to know that it is different between children and adults. Adults do have lower rates of vaccinations than Latino adults have lower rate of vaccinations than Latino children. I'm going to use the example of Combo 7, which is 4 doses of DTaP, 3 polios, 1 MMR, the Hep series, Hep B's, and varicella vaccine, and 4 PCV. So that's Combo 7. So for 2016, the coverage of this Combo 7 was lower among non-Hispanic Black children, was low in children living below the federal poverty line, and in children insured by Medicaid or uninsured. So in general, Latinos have the same coverage as most of the rest of the population, but non-Hispanic Blacks, people who were poor, and people uninsured and insured by Medicaid had lower rate of vaccinations. And the HHS in 2018, every year puts out a table of what is a poverty line, who is below the 100% of the federal poverty line. And as an example, for a family of 4 for this year, if you have family of four and you make less than $25,100, you're considered to be below the third of poverty line. And to give an example of the coverage rate for this vaccine, in the US, the rate was 70.7%, and Latinos had comparable rates with most other race or ethnic groups, but Black non-Hispanic had a significant lower rate. In Illinois, the overall rate of this combo is 71.5%, and for Hispanics, it's a little bit lower, 66.8%. And everybody's falling short of the Health People 2020 goal for this combo of 80%. So what are the barriers to healthcare among Latinos? We spoke before, poverty being a significant barrier, lack of health insurance also being a significant barrier. A lot of Latino families work in service-related works or seasonal works or self-employed, so episodic health coverage for people who work in these industries it could be an important factor to seek healthcare. Sometimes if you work in the farm and you make enough money during some periods of time, you may not qualify for Medicaid during that time, but then when you don't, then you do qualify. So you may have episodic health coverage. If you have a lack of a regular source of care, it could be a barrier. Language and English proficiency, it's definitely a barrier. And it is important to know that there's not enough workforce to serve those Latinos who do not speak English well or very well. Sometimes the medical terms are complex and patients can leave the visit confused. We have an impersonal health care system in the US, and it's important to know that Latinos trust their providers, just like they trust their priests, the teachers, they trust their providers. So we have to take advantage of this wonderful asset. For Latinos, and this applies for many people, for Latinos definitely does, the doctor-patient relationship should feel personal and welcoming. And it's okay to validate traditional medications and beliefs. It's important to know that they exist, and it's important to validate them, and if they're going to cause no harm to the patient. Short time in the clinical visit. Our system is made to see patients at a fast pace, so that this definitely puts a barrier in the trust that our patients have on us. So one of the things that we can do, and this has been studied, 1 minute sitting down lasts much longer than 1 minute standing up. So we should sit down when we talk to our patients. For Latinos, extended family has an important role in decision making. So sometimes it is a good idea to involve grandmothers, aunts, uncles. So sometimes it is important to take the extended family to during the decision-making process of healthcare. There's resistance with some vaccines. With the flu vaccine, some people may say that I always get sick when I get the flu shot. And for the HPV, I think it has been very important to detach the vaccine from sex and attaching it to cancer prevention. I think this has been very positive in our rate of HPV vaccination. And with the MMR, there's still some concerns about autism. And as a system, there was a significant barrier placed in our state in October 2016 when VSC, the Vaccines for Children program, stopped providing vaccines to Title 21 and state-funded Medicaid patients without adequate planning. And most state-funded patients are children born outside of the US. So Latino children have been significantly affected by this change. So how do we improve coverage? And this is adapted from the community guide, which was put together by the Community Preventive Service Task Force. So there's 3 prongs to do this. One is enhancing access to services by increasing coverage, decreasing co-payments, coordinating vaccination interventions at school, so school is attentive what vaccines are needed, and then let the patient know to go back to the provider. Increasing community demands. You should notify people when they are due for their immunizations. You can have reminders, recall systems in communities or health care centers to remind patients about their vaccines. You can have incentives like food vouchers, gift cards for keeping up with vaccinations. You can develop policies that require vaccinations before attending school. We have that in our state. You can also use provider or system-based interventions. One thing that is very useful, it's a provider-based intervention, but it's very useful, is do pre-clinic huddles. So the team, the MA, the RN, and the provider They take 5 minutes at the start of every clinic to go over the schedule of the patients and identify patients needing immunizations. You can use EHR alerts to remind providers when patients are due for vaccinations. You can develop standing orders that allow non-physician personnel to administer vaccines. You can establish continuity of care and extraordinary provider-patient relationship. Remember that Latinos trust their providers, so your recommendations is always usually trusted. And the use of our Illinois eye care system right now is unidirectional, meaning the information goes from the EHR to the eye care system, but having a bi-directional eye care system would be helpful in tracking vaccines. And then you can combine all these interventions. So the conclusion about Latinos and healthcare immunizations. Although Hispanic children have a similar immunization coverage rate than most other groups, we all fall short from the Healthy People 2020 goal. And Hispanic adults definitely have a lower vaccination rate. Disparities in childhood immunization coverage still persist, especially for those uninsured and those living below the federal poverty line. Limited English proficiency and impersonal healthcare can be barriers to access care and receive immunizations. We should consider that some of the recommendations from the Community Preventive Services Task Force of enhancing access, increasing demand, and using system-based interventions. And in Illinois, eye care having a bi-directional data transfer could be very useful. And if eye care has a recall capability, that can also be useful. And it's important for the state and the managed care organizations to reimburse providers for Title 21 and state-funded vaccines. Thank you very much.